Before any pill, before any cream, there is a heavy silence that many men over 60 carry every single day, a silence that presses on the chest, steals confidence, and slowly erodes intimacy. Countless older men live with questions they never dare to say out loud, questions whispered with shame and quiet surrender, questions like, "What is that erection cream called, and does it actually work?" Behind those hesitant words lies a deeper fear, the fear of losing virility, of losing control over one's intimate well-being, of no longer feeling like oneself. Many men avoid this topic even with their partners, even with close friends, and this understandable avoidance often turns into anxiety, fear of failure, and a profound sense of being alone with a problem no one else seems to talk about. Scientific data helps put this into perspective. Around 1 out of every 3 men over the age of 50 experiences some level of erectile difficulty. This number is not meant to frighten, but to normalize what happens naturally with aging. What truly matters is that many of these men feel a drop in sexual confidence, yet very few are aware that modern geriatric medicine offers effective and safe solutions. The goal is not just to improve an erection, but to reclaim independence, inner security, and the ability to enjoy intimacy with a partner without fear, tension, or guilt overshadowing the moment. If you have already tried quick fixes on your own, or followed advice found online without seeing real results, then this information is especially important for you. Here, the focus is not only on an erection cream known as Alprostadil, but on how to integrate it into daily life in a conscious, practical, and safe manner. Common myths will be dismantled, doubts clarified, and realistic strategies shared, strategies that can be applied starting today. Many men underestimate how powerful shared experiences can be, because hearing stories similar to one's own often brings relief, clarity, and renewed hope. This is not merely a collection of medical facts. It is an open space meant to normalize conversations about male sexual health later in life. Every detail explained here, from the proper use of Alprostadil to emotional readiness and environmental preparation, is designed to help restore confidence, vitality, and the pleasure of fully living one's sexuality. There are no miraculous promises or instant transformations offered, only clear and realistic tools that, when used responsibly, can genuinely change the quality of intimate experiences. Alprostadil is a medication available in cream or gel form, applied directly to the penis, specifically at the level of the urethra. Its primary purpose is to improve blood flow in the intimate area, allowing an erection to develop in a more natural way. Many men mistakenly expect it to act like a miracle solution, but it is essential to understand that it works by supporting physical processes already present in the body. It does not function on its own. Effective results depend on mindful and correct application. To visualize how it works, imagine nourishing a plant with fertilizer. The fertilizer does not create growth out of nothing, but when the soil is ready and the plant has the right conditions, it accelerates development and strengthens the roots. In the same way, Alprostadil enhances local blood circulation, increasing blood flow to the erectile tissue, but it delivers its best results only when both body and mind are prepared. This point is crucial because many men apply the cream hurriedly or without considering the surrounding context and later assume it failed, when the real issue lies in poor application or insufficient preparation. Unlike oral medications such as Viagra or Cialis, Alprostadil acts locally and does not broadly impact the digestive system or the heart. This makes it a valuable option for men who take daily medication for blood pressure, blood thinning, or who live with heart-related conditions. Since it does not circulate throughout the entire body, the risk of widespread side effects is significantly lower. Even so, following medical guidance remains essential to prevent irritation or discomfort and to ensure safe, effective use. Another crucial aspect that many men overlook is that Alprostadil requires a brief moment of application and a short waiting period before reaching its full effect. This is not a product that delivers instant results the second it is applied. The response usually begins within minutes, but true success depends on a delicate balance between physical readiness, mental calm, and appropriate stimulation. Understanding when and how to use it makes all the difference because this knowledge transforms uncertainty into confidence and allows intimacy to be lived with calm, control, and inner security. Alprostadil tends to be particularly effective for men dealing with mild to moderate erectile difficulties, and its benefits have been confirmed in numerous clinical studies involving men over 50. Not every man experiences these changes in the same way, and responses to treatment can vary significantly, which is why individualized medical evaluation remains essential. Some men notice occasional difficulties that appear only in specific situations, while others face a more persistent challenge that deeply affects confidence and intimate connection. To better understand who may benefit, it helps to picture different real-life situations. A 60-year-old man who has recently realized that his erections are no longer as firm as they once were may discover that this cream offers a fast, localized solution, helping him regain control during intimate moments without relying on treatments that affect the entire body. On the other hand, a 72-year-old man who has lived with erectile difficulties for many years may find that Alprostadil becomes a valuable complementary tool, especially when combined with pelvic floor exercises or carefully managed hormonal support, allowing him to maintain an active and fulfilling sexual life. Clinical observation consistently shows that age alone is not what limits success. What truly matters is the interaction between physical health, emotional balance, and consistent respect for medical guidance. Many older men feel a sense of relief when they learn they are not forced to rely solely on oral medications that might interact with treatments they already take. For men managing conditions such as high blood pressure, diabetes, or cardiovascular concerns, the local action of Alprostadil offers a reassuring advantage because it works exactly where it is needed, lowering overall risk and minimizing widespread side effects. It is equally important to recognize that the body's response to Alprostadil can change depending on how often it is used and how familiar the body becomes with the treatment. Some men benefit from an initial adjustment phase, during which they test the product alone or during relaxed, low-pressure moments, simply to observe their body's reaction. This gradual approach reduces anxiety, builds trust in the process, and prepares them emotionally and physically for real intimate experiences. Accepting this natural variability helps prevent frustration and supports a healthier, more optimistic view of sexual well-being later in life. For optimal results, careful preparation and correct application are essential. Before beginning, hands should be clean and completely dry because any residue can interfere with proper absorption. Think of it like preparing a delicate meal, where the quality of the ingredients matters, but cleanliness and careful handling are just as important. In the same way, proper hygiene of both the hands and the intimate area allows the cream to work at its highest potential. The next step involves applying a very small amount of the cream, typically no larger than a grain of rice, directly into the urethra. Accuracy and dosage is vital. Using too much may cause discomfort, while using too little can reduce effectiveness. Many men find it helpful to practice this step during calm, unhurried moments, without pressure or expectation, simply to become comfortable with the sensation and observe how their body reacts. This practice eases tension and strengthens confidence before an actual intimate encounter. The massage technique is another element that deserves real attention and should never be treated as a minor detail. Gently massaging the area for a few seconds helps the Alprostadil spread evenly, supports proper absorption, and encourages a stronger, more natural erection. Rushing this step or applying too much pressure can work against the desired effect because softness and patience allow the body to respond comfortably. Just as important is preparing the surrounding environment so the moment feels calm and inviting. A quiet space, soft lighting, gentle music, or any familiar stimulus that promotes relaxation can be the deciding factor between a positive experience and one filled with tension and disappointment. Another practical point that many men tend to forget is the importance of emptying the bladder before applying the cream. Urinating beforehand improves absorption and reduces potential discomfort during application. Afterward, it is advisable to avoid using the bathroom for at least 30 minutes, allowing the medication the time it needs to work effectively. These small actions may seem simple, Yet they're essential parts of conscious and effective use, forming the foundation for rebuilding confidence and a sense of control during intimacy. The effectiveness of alprostadil is not determined only by how correctly the medication is applied, but also by the emotional connection and level of stimulation present in the intimate moment. Many men mistakenly treat the cream as a purely physical solution, overlooking the powerful role the mind plays in sexual response. Creating a relaxed atmosphere where communication with a partner is open and honest becomes essential. Discussing desires, expectations, and emotions before intimacy builds trust, and this emotional safety amplifies the effects of the treatment. Picture a man who approaches an intimate moment feeling tense, worried that the cream might fail. If he finds the courage to express these concerns to his partner, that fear can transform into closeness and shared understanding. Stimulation is not limited to touch alone, but also includes words, tone, eye contact, and emotional presence. Gentle caresses, reassuring phrases, meaningful looks, and moments of connection before application help prepare the body, allowing circulation to increase more naturally and supporting a firmer, longer-lasting erection. Early relaxation and stimulation also play a crucial role in reducing performance anxiety and fear. Some men benefit from creating simple rituals before using the cream, such as a calming massage or a moment of emotional bonding, so the application feels less mechanical and more like a continuation of shared intimacy. This mindset not only strengthens physical response, but also deepens mutual pleasure and complicity, an especially valuable element in long-term relationships. Emotional connection also helps keep desire alive throughout the experience. While alprostadil improves blood flow, desire, engagement, and motivation remain essential for optimal results. This is why the combination of a supportive environment, continuous communication with a partner, and attention to both physical and emotional cues creates a powerful synergy that maximizes the benefits of treatment. Male sexual health is not only about chemistry within the body, but about caring for the body, the mind, and the bond shared with the partner as a whole. Alprostadil is considered a safe option when used according to medical guidance, yet understanding precautions and possible side effects is essential to avoid unnecessary discomfort or risk. Some men may notice mild irritation, a warm or burning sensation, or redness at the application site. These reactions are usually temporary and resolve on their own, but any persistent or worsening symptoms should prompt consultation with a healthcare professional. Every body responds differently, and individual sensitivity can vary, making awareness and attention to one's own reactions an important part of responsible use. One of the most frequent mistakes is using more cream than necessary, believing that a larger amount will make the effect faster or more powerful. In reality, this habit often leads to discomfort and can even cause the skin to become overly sensitive or less responsive over time. The safest rule is always to use the smallest amount that produces results and to strictly follow the instructions provided on the packaging or by a healthcare professional. Product authenticity also plays a critical role. The market is full of imitations that do not meet proper safety or quality standards, which is why obtaining alprostadil from trusted pharmacies or through a prescription is essential. Purchasing unreliable products online can seriously compromise health and undermine the expected benefits. It is also important to remember that alprostadil works locally and does not produce the same systemic effects as oral medications. In most situations, it does not place additional strain on the heart or significantly interfere with other treatments, making it a suitable option for men managing blood pressure, diabetes, or cardiovascular conditions. Even so, each individual situation deserves careful evaluation, and professional guidance remains necessary, especially in the presence of chronic illnesses or multiple medications. Additional small precautions can greatly enhance both safety and comfort. Avoiding scented soaps or harsh products before application, thoroughly drying the area, and applying the cream with a gentle touch all help reduce irritation and improve absorption. Developing the habit of observing how the body reacts over time also allows potential side effects to be recognized early and addressed calmly. Safe use of Alprostadil is not only about preventing physical issues, but also about the peace of mind that comes from knowing a reliable product is being used correctly, which directly contributes to a more relaxed and successful experience. Using the correct dose of Alprostadil is one of the most important factors in achieving good results while minimizing discomfort. The recommended quantity is typically very small, roughly the size of a grain of rice, and exceeding this amount does not accelerate the effect or guarantee a stronger erection. On the contrary, it often leads to irritation or a burning sensation. This is why carefully following usage guidelines and consulting a healthcare professional when in doubt is essential, ensuring the dosage is appropriate for each individual body and situation. Timing is another decisive element. Alprostadil is generally applied between 5 and 15 minutes before intimacy. This window gives the substance enough time to act within the urethra and allows blood flow to increase naturally. Applying it too early may result in the effect fading before the encounter begins, while applying it too late can trigger anxiety if the response feels delayed. Learning how one's own body reacts is crucial, and this often requires a brief period of practice to identify the most effective moment. Keeping track of personal experiences can also be extremely helpful. Maintaining a simple record that notes the time of application, the amount used, physical sensations, and level of arousal makes it easier to identify patterns and gradually improve results. This habit not only deepens understanding of personal physical responses, but also provides valuable insight for a healthcare professional if adjustments are needed or if the treatment is combined with other approaches. Such notes can also include details about the surrounding environment, communication with a partner, and relaxation techniques used, since all of these factors directly influence effectiveness. Observing how small changes affect outcomes allows a personalized routine to develop over time, one that optimizes the body's response. This mindful and attentive approach turns Alprostadil use into a complete process where dosage, timing, and preparation work together to ensure a safe, effective, and satisfying experience. Practice is essential for Alprostadil to work reliably and without triggering anxiety or self-doubt. At the beginning, many men feel uncertain and fear that the product might fail during a real intimate moment. This is precisely why dedicating time to gentle experimentation, without pressure or expectations, becomes so important. Trying it in a safe, private setting alone allows observation of how the body reacts, how long it takes for an erection to appear, and what sensations emerge. This process of familiarization gradually dissolves anxiety and builds confidence, because the man starts to understand his own timing and the way the medication supports his body. Repeating the application with awareness turns every experience into a lesson. Some men realize that applying the cream 5 minutes beforehand is not ideal and adjust to 7 or even 10 minutes. Others notice that small changes, such as posture, breathing, or mental relaxation, have a significant impact on erection firmness. Writing these observations down can be extremely helpful, noting not only physical reactions, but also emotional state and the level of connection felt during the moment. Practice also creates space to integrate relaxation and stimulation techniques. Experimenting with gentle massages, slow breathing, or moments of affectionate touch before intimacy can greatly enhance the effects of Alprostadil. Establishing a simple routine, perhaps once a week, dedicated to learning without performance pressure strengthens self-trust and makes the first shared experience with a partner after practice feel natural, calm, and deeply satisfying. Repetition helps develop physical memory, teaching the brain and body to anticipate the desired response. This reduces performance anxiety and reinforces a sense of control over the erection. Practicing regularly does not mean using the product every day out of obligation, but rather using it thoughtfully, observing bodily responses, and adjusting dosage, timing, and environment for each situation. This conscious approach transforms Alprostadil use from a mechanical act into a journey of self-understanding and sexual confidence, supporting an intimate life that feels free and reassuring. Caring for male sexual health goes beyond relying on a single treatment. When Alprostadil is integrated into a broader approach to overall health, its benefits often increase. Nutrition plays a vital role. A balanced diet rich in fruits, vegetables, omega-3 fatty acids, and low in saturated fats supports healthy blood circulation, which is essential for strong erections. Proper hydration and limiting alcohol intake are also important, as both directly influence sensitivity and physical response. Regular physical activity, especially exercises that improve circulation and strengthen the pelvic floor, can further enhance the effectiveness of Alprostadil. Activities such as walking, swimming, or targeted exercises like Kegels help train the muscles involved in erection control and endurance. When medication and healthy habits work together, each application becomes part of a more comprehensive process where scientific support and self-care reinforce one another. In certain situations, Alprostadil may be combined with hormonal adjustments under medical supervision, particularly when testosterone levels are low. This does not mean depending solely on medications, but rather observing how different interventions can safely reinforce results. For instance, a man managing high blood pressure and diabetes may benefit from a routine that combines Alprostadil, light cardiovascular exercise, and a carefully managed diet, allowing each element to work in balance to improve sexual function without compromising overall health. True integration also means paying close attention to mental well-being. Stress, constant worry, unresolved anxiety, or poor sleep can deeply interfere with how the body responds to any treatment. Introducing relaxation techniques, moments of meditation, or even professional psychological support can significantly improve results and strengthen the bond with a partner. The goal is not only to support an erection, but to create a space where intimacy feels safe, calm, and genuinely pleasurable. Every aspect of daily life influences how Alprostadil works, transforming sexual care into a conscious and complete practice rather than an isolated action. When combining different approaches, patience and careful observation become essential. No two men respond in exactly the same way, and adjusting strategies based on personal results is part of the process. Tracking habits, sensations, and progress allows both the individual and a healthcare professional to identify the most effective combination, promoting safety, independence, and overall well-being. Integrating Alprostadil into a broader vision of health is not an indulgence, but a smart and responsible way to experience sexuality with confidence and pleasure at any stage of life. One of the most valued advantages of Alprostadil is its fast onset of action. Unlike other treatments that require hours or even days before showing any effect, this medication works directly on blood flow in the penis, often producing an erection within minutes. This rapid response not only increases practical effectiveness, but also helps reduce performance anxiety, which is one of the most common contributors to secondary erectile difficulties. Many men feel reassured knowing they can rely on a quick and predictable response, turning intimacy into something more spontaneous and far less stressful. Applying the product locally also means that its effects remain concentrated, without influencing the rest of the body, reinforcing a strong sense of control and autonomy. This feeling of control plays a vital role in psychological well-being, allowing intimacy to be experienced without fear of sudden failure or unexpected reactions. This autonomy also gives men the freedom to choose the right moment for sexual activity, adapting to personal needs and the rhythm of a partner without being bound to rigid schedules or delayed responses. Another significant benefit is that Alprostadil can be safely used by men managing chronic conditions such as diabetes or high blood pressure, with minimal interaction with their existing medications. This reliability makes it a strong option within a comprehensive health plan. When combined with complementary strategies like pelvic floor exercises or thoughtful dietary adjustments, results can improve even further, enhancing overall vitality. Better circulation and sexual response often translate into renewed energy, satisfaction, and a deeper sense of personal value that extends beyond the bedroom. Stories shared by men who use Alprostadil correctly often reveal more than physical improvement. Many describe stronger relationships and deeper emotional closeness with their partners. The predictability of the response lowers anxiety and opens the door to more honest communication, creating a relaxed and positive atmosphere. Some men even discover that this support encourages longer foreplay and new ways of connecting, increasing closeness and shared pleasure. These benefits are not only physical, but emotional, helping reconnect with desire, confidence, and enjoyment of intimacy. Ultimately, the results become clear and measurable, allowing each man to evaluate effectiveness in a concrete way and adjust habits and routines to maintain progress. When used with proper guidance, consistency, and responsibility, Alprostadil becomes more than a treatment. It becomes a powerful ally that restores confidence, satisfaction, and overall well-being, helping men reclaim autonomy in one of the most meaningful aspects of adult life. Accepting the presence of erectile difficulties is not a sign of weakness, nor does it take away from masculinity. In fact, recognizing a challenge and actively seeking solutions reflects intelligence, self-awareness, and responsibility toward oneself. Many men initially feel shame or fear, worrying about how this situation might affect their relationship or their sense of worth. It is essential to remember that erectile dysfunction is a widespread medical condition, particularly among adult and older men, and it does not define a man's value, strength, or identity. The psychological dimension is just as important as the physical one. Anxiety around performance and the constant fear of losing an erection often make the problem worse, creating a cycle that turns intimacy into pressure. Tools like Alprostadil help break this cycle, not only by supporting physical response, but also by easing tension and restoring calm. Each positive experience reinforces confidence and rebuilds a sense of control over one's body and sexual life. It is also important to remember that sexuality does not expire with age. Many men rediscover pleasure, closeness, and desire with their partner even after many years together. Honest and open communication becomes a powerful ally in this process. Sharing the situation, involving the partner, and aligning expectations creates an atmosphere of support and understanding that enhances results and deepens emotional connection. In this context, the use of Alprostadil becomes natural and respectful, reducing misunderstandings and removing unnecessary tension. Caring for emotional well-being has a direct impact on how effective any treatment can be. Relaxation practices, controlled breathing, or simple mindfulness moments before intimacy can improve physical response and heighten the experience of pleasure. The connection between mind and body is fundamental, and when it works in harmony with proper treatment, outcomes tend to be more stable and rewarding. The core message is deeply motivational. Seeking solutions and taking care of oneself is not a sign of fragility, but of maturity and self-respect. Choosing to learn, to practice responsibly, and to approach intimacy with a positive mindset strengthens self-esteem, improves relationships, and restores a sense of freedom and completeness in sexual life. Turning concern into action, uncertainty into understanding, and anxiety into confidence is a powerful transformation because every step taken toward sexual health is also a step toward a fuller and more satisfying life. As this journey reaches its final stage, it becomes important to bring all the information together in a clear and practical way. The first essential point is that erectile dysfunction is common and can affect men at different moments in life, and that effective solutions like Alprostadil are available. Successful results depend not only on the medication, but also on combining healthy habits, open communication with the partner, and attention to emotional balance. Every phase, from preparation to application, should be handled with care, following guidance and maintaining a calm and comfortable environment. Establishing a clear and personal routine can make a significant difference. This includes preparing a private space, ensuring cleanliness and comfort, and selecting the most suitable time based on individual rhythms and needs. Writing down each experience helps reveal patterns, highlights what works best, and guides possible adjustments in dosage or technique. With gradual and mindful repetition, confidence grows and anxiety fades, directly contributing to a more relaxed, satisfying, and rewarding intimate experience. Equally essential is the integration of healthy daily habits. Maintaining a balanced diet, staying physically active, and protecting quality sleep naturally support erectile function and amplify the benefits of Alprostadil. Addressing emotional factors is just as important because stress and anxiety can quietly interfere with physical response. When medical treatment is combined with relaxation techniques or mindfulness practices, the experience becomes more complete and enjoyable, reinforcing a sense of safety, control, and independence in intimate life. This practical approach can ultimately be summarized in a few core principles: understanding how the medication works, preparing the right environment, carefully following instructions, communicating openly with the partner, and taking consistent care of both physical and emotional health. Acting in this integrated way not only improves erectile response, but also strengthens self-confidence, deepens the relationship, and increases personal satisfaction. Regular follow-ups with a professional help ensure proper guidance, prevent mistakes, and fine-tune results over time. Adopting these conscious habits transforms each experience into an opportunity for learning, reassurance, and pleasure, allowing treatment to remain positive and empowering. At this point, you now hold a complete set of knowledge, practical guidance, and strategies to address erectile difficulties safely, effectively, and with full confidence in the process. This reinforces a powerful idea that every mindful action, every moment of practice, and every honest conversation becomes a step toward a healthier, more satisfying, and more fulfilling sexual life built on awareness, responsibility, and renewed confidence.